Hello my dear students, welcome to our channel Aspire 32. Thank you for all the likes and the shares what you gave for our last video on pulpal diagnosis. So here I am with another video. This time I am going to help you with the periapical diagnosis. So as mentioned in the earlier video that whenever you have a vertical tenderness on percussion or swelling associated with a tooth, it generally indicates that the infection has transferred from pulp to the periapical area. Now there is one important question in NBDE and NEET that can you have a periapical disorder without pulp being involved? Now most of you may think that it is not there, but it is actually not true. Now you can get a periapical disease without pulp being involved. Now what is the example for it? If you do a restoration with a high point, what will happen is there is a constant pressure on the periapical area when the patient bites on it, and there will be inflammation of periapical ligament. This leads to apical periodontitis. So you can have apical periodontitis in a vital tooth. So coming to the history of present illness, we tend to ask about pain, swelling associated with any tooth. So when it comes to history, the first most important factor is the pain, and you ask the patient whether he or she has the pain. Now when the patient says that I have pain, we have to ask him whether it is mild or severe. Now imagine the patient says that he has a severe pain. Severe pain means that the disease is acute, but does that mean that there is only one periapical disorder which has acute pain? That's not true. Basically, there are three periapical disorders which may present as severe pain. That is your symptomatic apical periodontitis, acute periapical abscess, or acute exaggeration of a chronic lesion, which is also called as phoenix abscess. Now coming to the next scenario where the patient says I have a mild pain or there is no pain. Here also it doesn't mean there is one clinical diagnosis. Mild pain or no pain can be associated with asymptomatic apical periodontitis, chronic periapical abscess, or it can be associated with a cyst or condensing osteitis. So as you can see, by just knowing the pain, we cannot pinpoint one single periapical diagnosis. That's why it is important to have multiple diagnostic factors. Now coming to the second section, that is clinical examination. You took the mouth mirror and probe and percussed on the tooth. Now if you have a vertical tenderness on percussion which is quite severe, then it generally indicates that there is periapical disease. Now when you have the vertical tenderness of percussion, there can be two diagnoses. One is the symptomatic apical periodontitis or periapical abscess, which is acute in nature. So just presence of vertical tenderness on percussion doesn't mean that there is only one periapical diagnosis. So if there is no vertical tenderness on percussion, then what is the diagnosis? Absence of vertical tenderness or percussion doesn't rule out any periapical diagnosis. It is associated with chronic periapical abscess, asymptomatic apical periodontitis, or a cyst and condensing osteitis. The next aspect of clinical diagnosis is presence of sinus tract. If you have a sinus tract, you can trace it with a GP point. The presence of sinus tract generally indicates that the case is chronic periapical abscess. But there are cases where if there is a cyst, then also you can find the sinus tract. So the next clinical examination is the palpation of swelling. Generally, a swelling which is soft in nature indicates that it is acute periapical abscess. But if the swelling is hard, it generally means it is because of a chronic lesion. You can find small hard swelling in a chronic abscess, but hard swellings are generally associated with a cyst. So as seen, you cannot find any swelling associated with apical periodontitis, whether it is symptomatic or whether it is asymptomatic. Now coming to the next section, that is radiographic examination. This section is very important because if you just have the history and the clinical examination, you have realized that most of the signs and symptoms overlap with many of the periapical disorders. But it is the radiograph which can differentiate each periapical disease. So as seen in this radiograph, you can see a large carious lesion involving the pulp. If you see clearly, we can appreciate the widening of PDL ligament in the mesial root. There is a very important landmark called as lamina dura, which is basically a radio-opaque line which covers the periodontal ligament. So in this radiograph, you can see the lamina dura is intact, but there is widening of PDL space. Now this is a diagnosis for apical periodontitis, but you cannot say whether it is symptomatic or asymptomatic by just looking at the radiograph. Now coming to the next radiograph. In this radiograph, you can appreciate that the lamina dura, which is a radio-opaque continuous structure, is not visible. That means the lamina dura has broken down. Second, there is a mild radiolucency at the mesial root of the tooth. So if you have an X-ray where there is no lamina dura and there is a very mild radiolucency or there is no radiolucency, then this case belongs to acute periapical abscess. Now the word acute is very important, because if you have a break in the lamina dura and you don't see a radiolucency, that can only happen in acute disorders, because the radiograph can only show the signs of an abscess if there is 30 to 40% mineral loss. But because it is acute in nature, there is no sufficient time for mineral loss, and that's why you don't see any radiolucency in the acute periapical abscess radiograph. Coming to the next radiograph, in this radiograph you can clearly see there is break in the lamina dura and there is a clear small radiolucency associated with the roots. Now the break in the lamina dura definitely tells you that this is an abscess case, but because now you can see a clear radiolucency, this is a case of chronic periapical abscess. Now why it is chronic? Because there is sufficient amount of time for mineral loss so that the radiolucency can be seen on the radiograph. Now this is the next radiograph. If you see the radiograph periapical area, then the radiolucency is quite big. That is also surrounded by a radio-opaque line. Now this is a classic sign of a cyst, generally called as radicular or periapical cyst. Now coming to the last radiograph. As you can see in the radiograph, there is good amount of radio opacity surrounding the apex of the tooth. Now when you see such kind of radio opacity, one thing is very clear, that this is different from most of the periapical disorders, because you can see abscess, you can see cyst, all these lesions form radiolucent appearance on the X-ray. But it is just the condensing osteitis which actually forms a radio-opaque lesion. So as seen at the end of the radiographic examination, we can be clear that most of the periapical disorders are easily differentiated by looking at the radiograph. Now at the end of this lecture, we have realized that there are many diseases which may have similar signs and symptoms, but radiographically may have a different sign. So now let us combine all these important history, clinical examination and radiographic examination. Then let us come to the final diagnosis. So I have made this chart which will help you to differentiate with each periapical disorder. So if you see the first section, then the presence of pain or absence of pain I have clearly mentioned here. Swelling, soft tissue swelling is mostly associated with acute periapical abscess. Bony swelling is generally associated with chronic periapical abscess or mostly with the cyst. There is no swelling associated with apical periodontitis. When you talk about vertical tenderness or percussion, it is only present in symptomatic apical periodontitis or acute periapical abscess. Sinus opening is mostly associated with chronic periapical abscess or periapical cyst sometimes. Radiographically, the most important point is the lamina dura, which is intact in apical periodontitis but broken in acute periapical abscess. In acute periapical abscess, you won't have radiolucency, but you will find it in chronic periapical abscess. And the cyst is associated with a large radiolucency with radiopaque border. And in condensing osteitis, you will have the radio opacity at the periapex. So I hope you found this video helpful. Feel free to ask your queries in the comment section. Also, don't forget to subscribe to our channel and share this video with your friends and colleagues. Thank you for visiting our channel Aspire 32.